Electrophysical method. The single neuron recording. Single neuron recording, also known as a single unit recording, is a method of measuring and recording the electrophysiological changes across the cell membrane of a single neuron using a microelectrode system. The basic principle of single neuron recording. 1. In this procedure, a small pipette filled with an electrolyte solution is inserted through the cell membrane to the interior of the neuron. 2. Then another electrode called the indifferent electrode is placed in the extracellular fluid, and the potential difference between the inside and outside of the fiber is measured using an appropriate voltmeter. 3. This voltmeter is a highly sophisticated electronic apparatus that is capable of measuring very small voltage despite extremely high resistance to electric flow through the tip of micropipette, which has a lumen diameter usually less than 1 micrometer and the resistance more than a million ohms. 4. The recording of the rapid changes in the membrane potential during the transmission of nerve impulse. The microelectrode is connected to an oscilloscope. 6. If the electrode is outside the nerve membrane, the recorded potential is 0, which is the potential of the extracellular fluid. Then, as the recording electrode passes through the voltage changes area at the cell membrane of a potential decreases abruptly to minus 90 millivolts. Moving across the center of the fiber, the potential remains at a steady minus 90 millivolts level but reverses back to 0 the instant is passed through the membrane on the opposite side of the fiber. Patch clamp method. The patch clamp method is used to detect record ion current flow through single channels, as is the case through a wide array of process that utilizes ion gated channels. The technique is especially useful in the study of excitable cells such as neurons, cardiomyocytes, muscle fibers, and pancreatic beta cells, and can also be applied to the study of bacterial ion channel in specially prepared giant spiroblast. The Erwin Neher and Bert Sackman developed a patch clamp in the late 1970s and clearly 1980s. In this method, a micropipette having a diameter of 1 to 3 micromole is placed against the outside of the cell membrane. 1. Then suction is applied inside the pipette to pull the membrane against the tip of the pipette. This creates a seal where the edge of the pipette touches the cell membrane. 2. The result is a minute membrane. The result is a minute membrane patch at the tip of the pipette through which the electrical current flows can be recorded. 3. Alternatively, the small cell membrane patch at the end of the pipette can be tore away from the cell. 4. The pipette, which is sealed patch, is then inserted into the free solution. This allows the concentration of the ion both inside the micropipette and in the outside solution to be altered as desired. Also, the voltage between the two sides of the membrane can be set at will, that is, clamped to a given voltage. It has been possible to make such patches small enough so that only a single channel protein is found in the membrane patch being studied. By varying the concentration of different ions as well as the voltage across the membrane, one can determine the transport characteristics of a single channel and its gating properties. Electrocardiography (ECG). The electrocardiography is a procedure of recording the electrical activity of heart over a certain period by utilizing electrodes that are placed over the skin. During the cardiac cycle, the heart depolarizes and repolarizes during the generation of a heartbeat. These electrical changes are carried through the muscles and bones and can be measured by electrode placed on skin. The changes of voltage recorded from the heart with respect to time when plotted on a graph is referred to as a electrocardiogram. The normal electrocardiogram, as represented in the figure D3, is composed of P waves, a QRS complex, and a T wave. The QRS complex is composed of three different waves, Q, R, and S. 1. The P wave is caused by the depolarization of the atrium prior to the beginning of atrial contraction. The P wave exists for a total duration of 0.08 to 0.1 second. The P wave is followed by zero voltage stage, which represents the conduction of impulse through the AV node and the bundle of His. The time required from the initial onset of depolarization represents in P wave till the peak voltage during the depolarization is termed as a P or interval, which lasts for 0.12 to 0.20 second. A P or interval less than 0.2 second indicates towards the presence of a first degree hot block. 2. The QRS complex is caused by the electrical potential generated during the ventricular depolarization, with Q representing downwards deflection immediately preceding a ventricular depolarization. The R represents the peak voltage potential generated during the peak of contraction, while S is a downward deflection following it. This phase lasts for a period of 0.06 to 0.1 second. 3. The T wave represents the recovery phase of a ventricular contraction, and it is termed as a repolarization wave. 4. The U wave is smaller successor of T wave that is not always observed in an electrocardiogram. 5. The time required for ventricular depolarization to repolarization is termed as a QT interval, which ranges from 0.2 to 0.4 second. Brain activity recording. Observing and recording the activity of brain is extremely important in order to understand its function and its relationship to the different physiological processes of the body. The functioning of the brain occurs mostly through the electrochemical excitation of the nerve cells that makes up the brain. The electrical recording from the surface of the brain or even from the outer surface of the head demonstrate that there is a continuous electrical activity in the brain. The variation in the electrical activity of the brain are observed in an electroencephalogram (EEG), which records the undulation in electrical potential. 1. The intensity of a brain wave records from the surface of the head ranges from 0 to 200 microvolts, with the frequency ranges from once every few seconds to 50 or more per second. The characteristics of the wave is dependent on the degree of activity in respective parts of the cerebral cortex, and the waves changes markedly between the different states of the brain activity. 2. The electrical potential generated by a single neuron is beyond the direction limit of EEG processes. The electroencephalogram processes is thus used to present the summation of synchronous activity of thousands of neurons that have similar spatial orientation. The activity of neurons involved constant exchange of ion with the extracellular space to maintain a resting potential and to propagate the action potential. The ions of similar charge repels each other to form an electrical waves in a process known as a volume conduction. These waves of ion are detected by the electrodes placed on the scalp. 4. These metallic electrodes attract or repel electrons. As metal conducts the push and pull of electrons easily, the difference in push or pull voltage between any two electrodes can be measured by voltmeter. Recording these voltage over time gives us the EEG. 5. The conventional scalp EEG. The recording is obtained by placing the electrodes on the scalp with a conductivity gel or paste. Many systems typically use electrodes, each of which is attached to an individual wire. 6. Each electrode is connected to one input of the differential amplifier. A common system reference electrode is connected to the other input of each differential amplifier. These amplifiers amplify the voltage between the active electrodes and the reference electrodes. 7. The most EEG system these days, however, are digital, and amplified signal is digitalized via an analog to digital converter. After being passed through an anti-aliasing filter, the normal healthy people, most waves in the EEG can be classified as alpha, beta, theta and delta waves. 1. Alpha waves. These are the rhythmic waves that occurs at a frequency between 8 and 30 cycles per second and are found in the EEG of almost all normal adult people when they are awake and in a quiet resting state of cerebration. These waves occurs most intensely in the occipital region but can also be recorded from the parietal and frontal region of scalp. These voltage usually about 50 microvolts. 2. Beta waves. These occurs at a frequency greater than 14 cycles per second and as high as 80 cycles per second. They are recorded mainly from the parietal and frontal region during the specific activation of these parts of the brain. 3. Theta waves. These have the frequency between 4 and 7 cycles per second. They occur normally in the parietal and temporal region in the children, but they also occurs during the emotional stress in some adults, particularly during the disappointment and frustration. The theta waves also occurs in many brain disorders, often in degradative brain status. 4th, delta waves. These includes all the waves of EEG with a frequency less than 3.5 cycles per second, and they often have voltage 2 to 4 times greater than most other types of the brain waves. They occur in very deep sleep, infancy, and in serious organic brain diseases. The limitation of EEG. EEG has several limitations. The most important is its poor spatial resolution. The EEG is most sensitive to a set of post synaptic potential, those generated in a superficial layer of cortex on the crest of gyri, directly abrupting the skull and radial to the skull. The dendrites, which are deeper in the cortex inside this sulci in midline or deep structure, such as a cingulate, gyrus, or hippocampus, or production current that are tangential to the skull, have a far less contribution to the EEG signal. The strong non synchronous nerve signals often nullify any other in the recording brain waves because of opposing polarities in EEG. Magnetic resonance imaging (MRI) scan. A magnetic resonance imaging scan is an imaging test that can be gives very detailed images of the inside of the body. Instead of using the X-ray, the MRI uses a strong magnet, lower energy radio waves, and a computer to produce images. The MRI scanners use a strong magnetic field gradients and radio waves to generate the images of the organs in the body. The magnetic resonance imaging is a medical application of a nuclear magnetic resonance (NMR). The hydrogen atoms are most often used to generate a detectable radio frequency signal that is received by the antennas near the anatomy being examined. The hydrogen atoms are naturally abundant in people and other biological organisms, particularly in water and fat. For this reason, most MRI scans especially or essentially map the location of water and fat in the body. 1. The MRI scan can provide detailed picture of any part of the body. The MRI is used when it is the best test to help diagnosis or easy or assesses your condition, or when simpler and less expensive tests have failed to give a diagnosis. 2. The MRI is often recommended for imaging the brain and spine because of detailed high quality images. It is also useful in assessing the knee injuries and other sport injuries, as it is a good at showing problems with soft tissue such as muscles, tendons, and ligaments. 3. The MRI often used in addition to other tests, including other imaging tests such as ultrasound. MRI can sometimes show conditions or details that other images tests cannot provide. The basic principles of MRI. 1. The magnet in the MRI scanner creates a magnetic field which causes the hydrogen atoms in the human body to line up in the same direction. 2. The radio waves are then passed into the part of your body being scanned, move the hydrogen atom out of the alignment. 3. The pulses of radio waves excited the nuclear spin energy transition, and the magnetic field gradients localize the signal in space. By varying the parameter of pulse sequences, the different contrast may be generated between the tissue based on the relaxation property of hydrogen atom therein. 4. When the radio wave are turned off, the atom reagin, and as they do so, they produces a radio signal. 5. The signal are transmitted to radio antenna and receivers, and the computer picks up this information and generates images. 6. The hydrogen atom are formed in the water, H2O. As the human body have a high composition of water, the hydrogen is found throughout the body. Due to the hydrogen atom in different types of body tissue lies at different speeds, they produces different signals. The disease tissue also gives off different signals from the healthy tissue. This allows the scanner to tell the difference between different tissue types and detect damage or disease tissue. Functional magnetic resonance imaging, fMRI scan. An fMRI scan is a functional magnetic resonance imaging scan that measures and maps the brain's activity. An fMRI scan can be used the same technology as an MRI scan. The image of MRI scan produces is just of organ tissue, but fMRI is produced an image showing the blood flow in the brain. By showing the blood flow, it will displace which part of the brain are being stimulated. The development of fMRI in the 1990s is generally credited by Shiji Ogawa and Ken Wang. As a brain imaging technique, fMRI have several significant advantages. 1. It is non-invasive and does not involve radiation, making it safe for the subject. 2. It has excellent spatial and good temporal solution. 3. It is easy for the experimenter to use. Basic principles of fMRI. fMRI works by detecting the changes in the blood oxygenation and flow that occurs in response to the neural activity. When the brain area is more active, it consumes more oxygen, and to meet this increased demand, blood flow increases to the active area. 2. fMRI can be used to produce a activation map showing which part of the brain are involved in a mental process. 3. During an fMRI scan, the patient is asked to perform a specific task to increase oxygen-rich blood flow to a certain part of the brain. For the task where the patient is asked a question, most of the time the patient is told to just think about the answer, that the way speech part of the brain is not activated as well. 4. The oxygen is delivered to neuron by hemoglobin in capillary red blood cells. When the neuronal activity increases, there is an increased demand for oxygen, and the local response is an increase in blood flow to regions of increased neural activity. 5. The hemoglobin is dimagnetic when oxygenated but paramagnetic when deoxygenated. These differences in magnetic properties leads to small differences in MR signal, magnetic resonance signal of blood depending on the degree of oxygenation. 6. Since blood oxygenation varies according to the level of neural activity, these differences can be used to detect brain activity. This form of MRI is known as blood oxygenated level dependent BOLD imaging. Positron emission tomography PET scan. A positron emission tomography PET scan is an imaging test that helps reveal how your tissue and organ are functioning. A PET scan uses a radioactive drug tracers to show this activity. This scan can sometimes detect the disease before it shows up on other imaging tests. The tracers may be injected, swallowed, or inhaled, depending on which the organ or tissue is being studied. The tracer collects in area of your body that have higher level of chemical activity, which often corresponds to area of disease. On a PET scan, on a positron emission tomography scan, this area shows up a bright spot. A positron emission tomography scan is useful in revealing or evaluating several conditions, including many cancer, heart disease, and brain disorder. Often, the positron emission tomography images are combined with the CT or MRI scan to create a special views. Basic principles of PET scan, positron emission tomography scan. 1. The positron emission tomography scanner functions by detecting the radiation given off by a substances injected into a person's body, which then collects across different parts of the body. 2. The radionuclide used in the positron emission tomography scanning are typically isotopes with short half-life, such as a carbon-11 approximately 20 minutes. nitrogen 13, approximately 10 minutes, and oxygen 15, 2 minutes, fluorescence 18, 110 minutes, gallium 68, 67 minutes, zirconium 89, 78.41 hours, or rubidium 82, approximately 1.27 minutes. These radionuclides are incorporated either into compounds normally used by the body, such as glucose or glucose analogs, water or ammonia, or into molecules that binds to receptor or other sites of the drug action. 3. The most commonly used radio tracer is called fluorodeoxyglucose, FDG. This is a chemical analog of glucose and it is metabolized through the same pathway. 3. This can be the help to identify cancer cells, as these cells tends to utilize glucose at an increased rate compared to other cells of the body. The uptake of fluorodeoxyglucose is then accumulated at high concentration at such region. 5. By analyzing the area where the radio tracer does and does not bind up, it is possible to detect the abnormalities in the cellular metabolism. 6. The system detects pairs of gamma rays emitted indirectly by a positron emitting radionuclide, most commonly fluorine 18, present in fluorodeoxyglucose. 7. As the radioisotope undergoes positron emission decay, also known as a positive beta decay, it emits a positron, an antiparticle of electron with opposite charges. The emitted positron travels in tissue for a short distance, typically less than 1 millimeter, but dependent on the isotopes, during which the time it loses kinetic energy until it decelerates to a point where it can interact with an electron. 8. The encounter annihilates both electrons and positron, producing a pair of annihilation gamma photon moving in approximately opposite directions. These are detected when they reaches a scintillator in the scanning device, creating a burst of light which is detected by the photomultiplier tube or silicon avalanche photodiode SiADP. Computer-aided tomography (CAT scan). The computerized tomography scan (CT or CAT scan) uses computer and rotation X-ray machines to create cross-sectional image of the body. These images provides more detailed information than normal X-ray images. The process makes use of computer processed combinations of many X-ray measures taken from different angles to produce the cross-sectional tomographic images of specific area of a scanned object, allowing the user to see inside the object without cutting. The digital geometry processing is used to further generation a three-dimensional volume of the inside of the object from a larger series of two-dimensional radiographic images taken around a single axis of rotation. The basic principle of computer-aided tomography scan. 1. The computer tomography operates by using an X-ray generator that rotates around the object. The X-ray detector are positioned on the opposite side of the circle from the X-ray source. 2. A visual representation of raw data obtained is called a sonogram. This is not enough for interpretation. 3. After acquiring the scan data, it must be processed using a form of tomographic reconstruction, which produces a series of cross-sectional images. 4. The pixel in an image obtained by the CT scanning are displaced in terms of relative radio density. Lesions and stimulation of brain. Brain lesions. The brain lesion refers to any type of abnormal tissue in or on brain tissue. The major cause of brain lesion generations are traumatic infection, malignant, benign, vascular, genetic, immune, plaques, brain cell death or malfunction, and ionizing radiation. Other chemicals and toxins have been associated with the brain lesion as well as. There are numerous consequences of developing such lesions. In most of such cases, the cause of developing developing a lesion must be unclear. Some common brain lesions is 1. Alzheimer's disease. The Alzheimer's disease is an irreversible progressive brain disorder that slowly destroys memory and thinking skills and eventually the ability to carry out the simplest task. The most people with Alzheimer's symptoms first appears in their mid-60s. It seems likely that damage to the brain starts a decade or more before memory and other cognitive problem appears. During this preclinical stage of Alzheimer's disease, the people seems to be symptoms free, but toxic changes are taken place in the brain. The abnormal deposit of the protein forms amyloid plaques and tau tangent throughout the brain, and once healthy neuron stops functioning, they lose connections with the other neurons and die. The damage initially appears to take place in the hippocampus, the part of the brain essentially in forming memories. As more neurons die, additional part of the brain are affected and they begins to shrink. By the final stage of Alzheimer's, damage is widespread and the brain tissue has shrunk significantly. 2. Abscesses. The abscesses is a collection of pus and inflamed tissue caused by inflammation and collection of infected material coming from local ear infection, dental abscesses, infection of paranasal sinuses, infection of mastoid hair cells of temporal bones, and epidural abscesses or remote lungs, heart, kidney infections source within the brain abscesses. The infections may also be introduced through the skull fracture following a head trauma or surgical procedure. 3. The cerebral infarction is an area of neurotic tissue in the brain results from blockage or narrowing in the arteries supplied blood and oxygen to the brain, which is usually caused by a stroke. Brain stimulations. The brain stimulation involves providing a chemical or electrical stimulus to certain region of the brain which causes excitation generation in the target region. The brain stimulation therapies can help a role in treating certain mental disorders. The brain stimulation therapy involves activating or inhibiting the brain directly with the electricity. The electricity can be given directly by electrodes implanted in the brain or non-invasively through electrodes placed on the scalp. The electricity can also be induced by using a magnetic field applied to the head. 1. Deep brain stimulation. The deep brain stimulation was first developed as a treatment for Parkinson's disease to reduce tremor, stiffness, walking problems and unconditional movement. In deep brain stimulation, a pair of electrode is implanted in the brain and controlled by a generator that is implanted in the chest. The stimulation is continuous and its frequency and level are customized to the individuals. 2. Electroconvulsive therapy (ECT). The electroconvulsive therapy uses a electrical current to treat serious mental disorder. This type of therapy is usually considered only if the patient's illness has not improved after other treatments such as antidepressant medications or psychotherapy or tried, or in cases where rapid response is needed, as in the case of suicide risk and catatonia, for example. The electrodes are placed at the precise location on the head. Through the electrode, an electrical current passes through the brain, causing a seizure that lasts generally less than 1 minute. Because the patient is under anesthesia and has taken a muscle relaxant, it is not painful and the patient cannot feel the electrical impulsant. 3. Vagus nerve stimulation (VNS). The vagus nerve stimulation works through a device implanted under the skin that sends electrical pulses through the left vagus nerves, half of the prominent pair of nerves that run from the brainstem through the neck and down to each side of the chest and abdomen. The vagus nerve carries messages from the brain to body's major organs, example heart, lungs and intestine, and to increases the brain that controls mood, sleep and other functions. 4. Repetitive transcranial magnetic stimulation. The ETMS uses a magnet to activate the brain. The first developed in 1985. The the RTMS, the repetitive trans trans transrenal magnetic stimulation, has been studied as a treatment for depression, psychosis, anxiety, and other disorder. Pharmacological testing. The pharmacological testing are used when one wants to evaluate if a substance is biologically active. There are many pharmacological tests, and each one of them demonstrate various aspects that are important for the understanding of the mechanisms behind illness, their causes and cures. The field encompasses drug composition and properties, synthesis and drug design, molecular and cellular mechanisms, organ or system mechanisms, signal transduction or cellular communication, molecular diagnosis, interactions, toxicology, chemical biology, therapy, and medical applications, and anti-pathogenic capabilities. 1. The metabolic stability and reactivity of the library of a candidate drug compound must be assessed for drug metabolism and toxicological study. Many methods have been proposed for quantitative prediction in drug metabolism. One example of recent computational method is SPO or spore calc. If the chemical structure of the medicinal compound is already slightly, this could slightly or dramatically alters the medicinal properties of the compound depending on the level of alteration as it relates to the structural composition of the substrate or receptor site on which it exerts its medicinal effects, a concept referred to as the structural activity relationship, SAR. 3. This means that when a useful activity has been identified, the chemist will make many similar compounds called analog to maximize the desired medicinal efforts of a compound. This development phase can take anywhere from a few years to a decade or more, and it is very expensive.